can't guarantee nerdy T-shirts today, but Kristen and Katie have definitely made data sexy, contemporary and funny. Thank you very much for that. But Janice and I will continue the WIN story to date, and we will give you a whistle-stop tour of how many reform-ready reviews there have been, how many final reports and tailored grants there have been, what are the priority actions coming from the process, and how those priorities, how we come to those priorities in the process. What is a co-contribution tailored grant? Why apply for the grant? And what aged care services providers are investing in their co-contribution grant? So, what has the WIN delivered so far? So we've heard throughout the morning that the WIN is limited in the fact that it's only in 10 regional areas of Australia so far. And we had kind of targets. Our target that we gave ourselves was 20 reform-ready reviews in each region. And to date, we have completed 192 reform-ready reviews. We've delivered 167 final reports have been delivered. And of that, of those final reports, 46 have moved to enterprise tailored grant so far, with 7 pending this week. We've established 10 regional reference groups, and we've had 13 regional projects approved. Now, this presentation, we will concentrate mainly on the tailored grant and the final recommendations data and kind of look at what that's kind of telling us. I will briefly talk about the regional projects, but the regional projects are mainly the content of this afternoon's roundtable discussion. So that's where we can have a real rich discussion about the collaborations that are going on regionally. I will now pass you on to Janice, who will take us through the priority actions, what are they, and how we came to identify the priority actions.
So exactly what are the priority actions and how were they developed? In this context, for the purposes of today, the recommendations, or what I'm calling the priority actions, are actually those specific actions which are identified at the end of the final report. They're on the last page of the report. They come out of a discussion of the questions of the Reform Ready review. For each question, the business partner and representatives from the organisation discuss the ratings of each question, where the organisation is at, and what, if any, are their gaps, and as well as their opportunities for going forward. From this discussion, and following discussion with other staff within the organisation, an interim report is developed. And this is an action plan for the organisation. It's based on the questions where there's actions placed against each and every one of the questions, with this action tailored for the organisation, actually based on the discussions that have come out. After this action plan is delivered to the organisation, the business partner then has a further discussion with the organisation to discuss these actions, and then to identify the specific priority areas, those smaller number of key actions which the organisation wishes to undertake in the immediate future. This is what's written up as the recommendations in the final report, these key actions. So why them, and why are they chosen? Generally speaking, the key actions will be reflective of the lower ratings for the specific areas. However, there will also be consideration of a number of other aspects. Recommendations will include actions which the organisation can use in their tailored grant application, as well as other priorities which will be completed in-house. But the main purpose will be to identify and highlight actions which will be completed within the immediate future. However, one thing that is important to keep in mind is that this doesn't mean that these are the only actions that an organisation is planning to complete as a result of the Reform Ready review. I've worked with a couple of organisations that have actually transferred all of the actions from the interim report directly into the organisation's own action plan. So they're actually planning on following up all or most of the recommended actions from the interim report. I've also discussed with other business partners, and they've also described how there may be a range of other organisational priorities that are identified qualitatively within the final report. They may not be highlighted as one of the priorities of the final report, but this might be because the organisation's already commenced the action. So while it's a priority for the organisation, it's not needed to be specifically mentioned as a step going forward, or else it might be something that they're completing in-house. Or it may be that the action will be completed with funding from outside the WIN program, so the organisation again didn't feel it needed to be specifically highlighted at the end of the final report. But for the purposes of today's analysis, we're looking at the end of the final report where the key priority actions have been identified. And as I've said, these actions are dependent on discussions between the business partner and the organisation with the agreement that these priorities are the ones to be highlighted. Which one do I press? That one. Aha. So what are the recommendations in the final reports? This pie chart reflects the top 5 priority themes. I thought it might be useful to give you some examples of questions from each section of the Reform Ready review to give you a sense of what type of topics are actually being reflected in these recommendations. So starting with the most frequent priority area, which is workforce plan, actions related to workforce planning section occur, as you can see, in 21% of all recommendations. This section asks questions about the presence of a workforce plan, as well as looking for links between the workforce plan and the organisation's strategic plan. It also considers whether the organisation has considered the impacts of the reform agenda on their workforce planning. Actions related to risk and financial management comprise 15% of all recommendations. And this section is about the organisation's analysis of risk and risk management generally, as well as risk analysis in relation to the impacts of the reform on the organisation. The section asks the organisation to consider its financial position overall, as well as with regard to funding the expected changes, so it also questions the organisation's financial viability going forward. 13% of all recommendations included actions related to business development and communication. And this section looked at the position of the organisation within the community, including its marketing. Also, does the organisation understand its target customer group? It also questions the extent consumer-directed care is included within the service delivery model, as well as the impacts of the reform agenda on the organisation's business and business model. Quality systems and processes actions are also included within 13% of the recommendations. And this section covers the organisation's quality systems of policies and procedures, together with the organisation's IT capacity and the IT integration between different organisational functions, as well as specifically referencing the reform agenda. As with business development and communication and quality systems and processes, actions related to strategy and direction also comprise 13% of the total recommendations. And as you might expect, this section questions the organisation's strategic planning, particularly with regard to consideration of the reforms, together with the communication of that plan. So overall, how does this look? This slide demonstrates the relative frequency of recommendations from each of the areas. The last slide considered the relative percentage of the recommendations within the total number of recommendations. This slide looks at the percentage of reports which contain each of the recommendations. Reports generally contain about 3 recommendations, although this can be more. So we thought it was also useful to break up the themes related to the actual reports, as this is a better indication of the overarching themes for organisations. For those who are mathematically reminded, recommendations for a number of different areas can be included within one report. So if you've been busy counting up all the percentages, that's why it amounts to more than 100%. There are 2 important things to note here. Even though we've dissected the statistics differently from the last slide, the top 5 recommendations hasn't changed. But interestingly, I think it's important to notice the difference in percentages, which I think is more relevant when you're considering the end of the reviews. For example, 64% of all the organisations who completed a review had workforce planning within their priorities. And 45% of the organisations identified through the review that an action related to risk and financial management was a priority. Rather than just going through and giving examples of the specific recommendations from a number of the reports, this is a Wordle which I've developed to encompass all the key priority areas from the final reports. After I developed this, I then went back to the recommendations to identify the context of some of the words. As you can see, development, this is the largest word. And when you go back to the context of it, it's all about developing new strategies, programs and processes for the organisation. But it's also about organisational development and staff development. The word plan, generally used in the way of developing a plan to go forward, and it covered the breadth of the business model from strategic planning to workforce planning to a plan to respond to the aged care reforms and the introduction of consumer-directed care. Strategic. Here the focus was generally on reviewing the current strategic plan to ensure that it aligned with the aged care reforms. But it was also about thinking strategically and developing strategic responses for workforce planning, business design, marketing, and generally considering the future. Some of the other words that you might like, that I like to identify, but which also demonstrate the focus of the recommendations. Again, we have workforce, business, management, review, implement, analysis, and of course, reform.
Thanks, Janice. I'm going to go on to talk a little bit about what organisations are actually choosing to invest in via their Enterprise Co-Contribution Taylor Grant. But just before we go into that, I wanted to explain to you what a co-contribution grant is and why the grant is set up in that way. The funding is available on a co-contribution basis to ensure buy-in to the solutions proposed. There is evidence in good practice workforce development that co-contribution grants are effective. It's essentially about what the employers get out of their investment compared with what they put in. So in other words, evidence that achievements and impacts are greater where there is a co-contribution because it fosters ownership. So what does the split between funding, cash co-contribution and in-kind contribution look like? And how much has industry contributed to the reform agenda and the reform projects? What we have here is two pie charts that are separated between the Enterprise Taylor Grants and the WIN Regional Grants. Now what you'll see on the slide is that the total investment so far for Enterprise Taylor Grants adds up to $1,753,641,000. The in-kind contribution equates to 23%. The cash contribution equates to 33%, and the WIN funding equates to 44%. So the sector is very much significantly contributing to their own future by investing in their future. You can see that from the split of the pie charts. And it's the same in the regional grants. In the regional grants, it is $1,576,397, which is the total amount of investment that's going into the regional grants across Australia. The in-kind contribution equates to 46% of the overall total project budgets. The cash co-contribution equates to 10%, and the grant funding equates to 44%. So we are demonstrating here that the sector are definitely committed to building capacity and supporting the sustainability of their aged care services as businesses and employers. But what's not really captured here and what has become apparent is the huge additional in-kind contribution that we aren't actually capturing because of the way that the grants are set up, the kind of rules around about the grant. And we've had a kind of conversation about this kind of informally within the kind of WIN team and with the people that we kind of speak to regionally. And I think that the figure, a kind of roundabout in-kind contribution, is significantly more. And that would obviously be something that we would like to maybe look at capturing in the future. Maybe we can do some work on that, because there's definitely something to demonstrate there. So how do you get to the point of actually applying for an enterprise tailored grant? Katie and Kristen took us through the process via to the interim report, and then Janice has spoken about how we come up with the priority actions from the final report or to the final report. When you have a final report, that then gives you access to a tailored grant. Now, not everybody is choosing to access a tailored grant, and there is reasons for that. Some organisations are choosing to decline for various reasons, such as the inability to secure the cash co-contribution funds. They're already committed to other projects. There's other time constraints, availability of workforce to support project implementation, and the availability of good quality consultants. But just because they are not choosing to go towards the tailored grant doesn't mean that there hasn't been great value in the Reform Ready review process, because we are kind of hearing that the Reform Ready review process of in itself is so valuable, and you don't have to necessarily access the tailored grant to kind of to conclude it. So of the organisations that are moving to accessing the tailored grant, some have a really clear understanding of what they want to do, and others don't, and they maybe have to go through board process or internal process in order to decide what they want to do with their tailored grant. But there are certain criteria. Your tailored grant application must align to at least one of your final recommendations in your final report. So what's on the screen here is basically the process that we take you through in order to apply for the tailored grant, and then what happens after you get the tailored grant. As part of the WIN service, the Client Liaison Coordinator, Robin Masala, who many of you will have spoken to, is now working alongside yourselves and your business partner, taking you through the grant application process. And the feedback that we've had so far about the process has been really wide-ranging, from I don't really understand what you're asking me to do, this is really time-consuming, or this was the easiest and quickest grant application that I've ever done, to I can't find a good consultant, or the timeframes are just too tight for me. So a particular learning from for the WIN programme that we've identified is that almost the timing of the WIN programme wasn't following your financial planning cycles. So that's been a real kind of learning for us, kind of going forward, is that in order to ensure that the co-contribution is there, you need to be able to plan for that. And we absolutely recognise that. So if you meet the eligibility criteria for applying for the grant, you demonstrate capacity to benefit your organisation and value for money, we will recommend your grant to the Department of Industry for approval. Once the tailored grant is approved, you will receive your signed funding agreement, and 80% of the total grant funding is then released. As part of the funding agreement, and this is a bit of kind of administration that I'm going to do here, so I apologise about that. As part of the grant funding agreement, you need to submit a progress report and evidence of the cash contribution before the 20% remaining funding is released. Some of you are at that point now where you need to. Where you actually need to submit your information. Okay, so what are the top 5 categories of tailored grant applications? The top 5 categories, the top 3, risk and financial management, quality systems and processes and strategy direction, all account for 19% each. So I think that that's very interesting, and that reflects what we've heard so far throughout the morning. Workforce planning, interestingly, is currently sitting at 13% of all Taylor Grant applications, and 10% are looking to do things around about business development, marketing and communications. So what are typical Taylor Grant activities? Well, if we look at strategy and development type work, some of the stuff that people are asking to do is to fund strategic planning and governance workshops, development of governance frameworks and strategic plans, reviewing strategic direction, so time out from operations to actually sit and do that in a facilitated process, situational audits and gap analysis work, creating new dashboards and KPIs, and developing business expansion models incorporating community care, for example, to ensure sustainability. When we're talking about the activities that organisations are undertaking as regards risk and financial management, one of the kind of most popular things that people are asking to do is a review of pricing strategies to get a consultant in to support them through that process. Reviewing their risk, their work health and safety management systems, to develop risk management systems, and to review their financial capacity to sustain current and future service provision. They're also looking at improving financial and risk analysis skills for senior staff, and some organisations are looking to review systems such as their payroll systems and looking at scoping new payroll systems. Quality management system activities that people are asking to do or are undertaking to do in the grant is reviewing their quality management system and putting in place training around about the implementation of their quality management system. They're asking to review their audit, to review their IT practices, to review their HR policies and procedures, and they're also looking to upskill their senior and middle managers in the implementation of policies. I'm conscious of time, so I'm going to skip on. Those 3 are the kind of most important, they're the most claimed for activities. But this graph is really quite important, and I don't want to miss the opportunity to kind of tell you about this graph. That blue line is where we are with the national benchmarking. So that's where all of the people that have participated in the in the Reform Ready review, that's where they're ranking themselves across the 13 priority areas. And then the red line is the percentage of final reports with a recommendation in this priority. Now, if you look at this should technically be a mirror image. So the red line should technically be a mirror image of the blue image. Yeah, it's not too bad. It's not too bad. What this is showing us is that where ratings have scored low, there have been more recommendations, and this goes back to the presentation earlier when Janice discussed how the recommendations were determined. So what this is showing us, it's given us confidence in the value of the RRR process as a rich, in-depth, supported self-assessment process that does reflect what the organisation needs and wants. So then if we add in the next component, which is what people are using to apply for their tailored grant, what you see there is that it almost does follow the same trend line, except from in workforce planning. So people aren't choosing to use their grant for workforce planning. Now, there is reasons round about that, and I can suggest some of them today. There is other funding out there, and I think that people are choosing to use that other funding and then use their Taylor Grant funding for something else. But for others, it also has been about there is already a lot of work having been undertaken in strategy and direction, with a focus on identifying the effect of the aged care reforms on the organisation's business, it is recognised as one of the impacts of the aged care reforms, is that a change in the required skills and skills mix of frontline staff through the introduction of consumer-directed care. It could be suggested that working to identify the effect of these reforms on the organisation is also actually the first step in workforce planning. So when you're doing strategy and direction work, which was quite popular with 19%, you're actually starting the workforce planning process. It could also be suggested from this graph that organisations are choosing to get back to basics and get their house in order. And they are also dealing with the most urgent aspects of the aged care reform, such as accommodation pricing for residential providers and or compliance type issues. Okay, so my parting thought, because I'm conscious that I'm probably over time, my parting thought is basically a nod to Kristen and Katie and Raj from the Big Bang Theory, and it's around about the uncertainty principle as it can be applied to business and workforce planning. It's not just about quantum physics. The uncertainty principle essentially states that in times of uncertainty, confidence generally does decrease, and our data has kind of bore that out. And if we analyse aged care in terms of the uncertainty principles, yourselves as leaders in the aged care sector can seize this opportunity to build sustainable organisations and develop our workforce to be highly flexible and responsive. We can turn uncertainty into opportunity for innovation, growth and sustainability. And as Raj would say, so uncertainty really is the mother of invention. And finally, are we able to say that the WIN process has been a catalyst for being proactive, innovative, in preparing aged services for change? I'm not going to answer that. I will leave that up to you to make that decision, and maybe that will be as part of the evaluation as well.
My question is around all the talk about workforce development and planning. Looking at what we've been presented with this morning and the scenarios that the service providers have shown us, what is really glaringly obvious is that we hear from the residents, we hear from the CEO, we hear from the administrator, the financial people, we hear from upper management, but in all of it, we only see the worker doing their job. Not once does a worker speak in any of these presentations. And I think it's really concerning that we're sitting here talking about the workforce, but the reality is we know the workforce is underskilled and it hasn't got a voice in any of this. And whether that's been in your data, I'm not sure, because that hasn't been talked about. It's been really talking about with the higher levels of it. But until there is an actual voice of that workforce, there's a big disconnect. So we know the reality is that aged care workers are overworked, understaffed, and they work 2 or 3 different jobs in different providers because they're part-time workers. They are dealing with being given tasks above and beyond their qualifications. They're too scared to speak up about it because their hours are cut, blah, 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 blah. And until there's some element of that here, I think it's not really reflective of the aged care industry, because the people who are doing the jobs aren't actually seem to be able to tell you how they could do their jobs better or what they need to do their jobs better.
I can answer that one. As a business partner, I obviously conducted reform-ready reviews, and as part of that, with every organisation that I worked with, the extra information I gained, I had one-on-one interviews, I had focus groups, and they were with the frontline staff. So as far as opinions of what was happening within the organisation, where they saw the gaps were, what they saw as the opportunities, that was actually collected from the staff as well as from the management. I think we've actually got a couple of other...
result of that? Like, where's the feedback that they came and that collection of that data says...
It was collected within each of the individual organisations, so it helped with that.
I get that, but what did that data that you collect show? That's what I'd like to hear, is what they actually said that they thought in reform could be of benefit.
The people completing the reform-ready reviews are staff in the aged care sector. So everybody's a worker in the aged care sector, and that's so where we've kind of came to, well, what you've seen earlier in the earlier presentations, where people were self-assessing themselves, organisations were self-assessing themselves. That has been such a long and in-depth process that the business partner has went through with the organisations. They've spoke to senior management, they've spoke to the board, they've ran focus groups with all different levels of staff and volunteers, and there was really rich conversation throughout that process, and the scores are a combination of that, and it's not just we just haven't spoke to the CEO of an organisation. We have spoke to such a breadth of people, and it's an organisational self-assessment that we have went through. So I think it is really very much the voice of the workforce. Everybody in this room is part of the workforce. I think it is the voice of the workforce.
I'm an outsider, and I'm John Cox, and I've come from South Australia at Beverly's suggestion. Oh, where is she? At Beverly's suggestion. I don't have a question, but I really just want to say how extraordinary you girls have been, and what a marvellous job you have done converting what was a cottage industry almost into a really professional organisation. And I think the presentation from you girls this morning has been breathtaking. And I just want to say
I just have a question. As a workforce planner in an organisation, and those who are from government in the room take this and hear it very clearly, without a national strategic workforce plan, it's very difficult to silo as an organisation. So peak bodies in the room, government representatives, without that being placed for the industry, a national strategic workforce plan, it's very difficult to do it in isolation. We need a template, we need a whole of industry approach to this, otherwise the reforms on our workforce are not going to get connection.
I would absolutely agree with you on that point, and I think what we're doing is building up from grassroots level to that point, to almost a crescendo point. Okay. Okay. Maybe that's what we'll do. And yeah. Okay. Okay. Here. Yeah. Are we all in agreement about that? Thank you. Thank you.
Very simple question for me, Diana Fitzgerald from Malaysia. What percentage of people who participated in the Reform Ready review actually accessed the tailored grants?
What percentage? At the moment it's sitting at, so it's round about 50 out of 192. So what's that? A quarter? We know that we are coming up to our closing date for tailored grants, which is really fast approaching, and we are encouraging and really supporting organisations through that process. But we realise the limitations are that we have really forced people through a process very, very quickly. They're kind of following our timescales because of the funding. We do have the 6-month no-cost extension, so that gives us a little bit of breathing space to kind of look at that, and we are looking at that just now, and we're kind of scoping that. Yeah. So
Thanks,
that's
Carolyn.
what.
And have you got a sense of how many more are likely to do it in the next couple of months?
Everybody tells us that they're going to do it. I really hope that they are. It's because there's so many steps in the process, and one of the things has been about good quality consultants as well. So it's about sharing information of people that so start swapping details of good quality consultants.
It's also their availability.
Yeah.
Because there's a lot of consultants out there that go, yes, no worries. February next year I can fit you in.
Yeah. Thank you.